This is a laryngoscope, or some are actually saying laryngoscope. I have heard people saying laryngoscope or laryngoscope. Both of them, both terms. This may be used. And look how I'm handling it. With my left hand, even though sometimes it is like this or like this.
Because you have to guide the tube with your right.
It is also a discriminative instrument, I've told you. To let basically the
Tube in the
right, and because the vast majority of people is right-handed, or are right-handed.
Does this have a light or something?
It has a light. Basically, it works like a flashlight. Whenever you open it, the batteries have to be inserted here. This is an old model that hasn't the blade detachable. Nowadays, the blades are detached and are washed or sterilized. Yes. The handle is not.
There's no need, but it's...
What do you mean there's no need? Because it is used. The laryngoscope? Well, I mean, do you think that this is just for one patient? This is a very expensive device. Clean it.
Yeah?
There's another tube. Where is the tube? So there was no other series of students associated with the loss of so many instruments like this series.
With this blade for a child.
Of course.
That's why you have this size.
I hope you're enjoying
the caliber.
And basically you are indignated in yourself somehow.
This chest tube again?
No, this is the
I'm
spike.
playing with this.
The spike of the chest tube that is not here anymore.
Ahmad,
Maybe doctor
This is a
Ahmad,
full instrument,
take it.
and this hasn't got its tube itself. I don't know who took it.
ما فهمت.
Another endotracheal tube. What is this? So all of these urinary catheters that have this bend on the distal end are Timan, or Timan-like if you want catheters. One of them, for example, so that was made of plastic.
But isn't
This
this
is
thicker?
there are two made of rubber.
But these are thicker though.
If you are not satisfied with the size, you are going to ask another one for your own catheterization. The idea is this: some of them are designed with a
Pointed,
some kind of point, even though it is still blunt.
of course.
Doesn't
ما
have
عليكيش
puncture
تعالي
in
اليوم.
it. Some of them are more blunt, like this. Like
إذا حدا
this
ما علمش
cone
شيء
shape.
يدي.
So this is like a cylinder shape, this cone shape. What is the name when you say something is losing basically from the diameter? This gradual loss of the diameter. There is a name. I have forgot. I don't have it in my mind. How do you call it? So besides cone shaped, because when something is tapering, that is the idea. When it loses the diameter gradually, it's called tapered. Tapered or tapering.
يلا نلحق اللكتشر.
Laser.
نلحق.
What tapework? Not tapework.
Like
This is for the trachea when you put the
Harry.
this
Right.
is here when you put it, right? You can't
It
put it in
is
the
similar
mouth.
with this,
But it is short.
not with this.
But this is short.
So what, Basta? This is larger than the diameter of the trachea.
No, not the diameter of the trachea. This is short distance. Like this, like, right? Like,
You don't have to reach the hypopharynx. You have just to load the base of the tongue to prevent posterior displacement of it and let's say
But you need to adjust the airway size from the angle of the mouth to the for child, for children.
yes, of course. Some of the doctors are saying that it was designed in order to also to maximize the mouth-to-mouth respiration, but it is not functional. Why? Because you cannot actually seal the instrument or the mouth of the patient around the instrument, even though you can blow on the other end. So this is not functional. It is not even good for hygiene purposes or for suction, because this is girdle. This is an oropharyngeal airway, and like safar, and this may be used also to create some kind of let's say way for suction purposes. This one is not good because it has a lot of curvature, it's very long, and
No, but some of the doctors has it in their car and they have one normal and one small for children.
yes, I don't contradict. There may be, but usually you have to have, unless you are, let's say, an emergency physician that works on the field and you don't know what kind of patients are going to treat. It is useful to have different sizes, or maybe this kind, one for children, one for, even though more practically is to have separate ones. Girdle airways for adults, girdle airways for children. Because this is too long, it can just drop out of the mouth. So it is not a very far.
But it's better for
هتسمع اقول لك
The idea is this, where's girdle? Fixate.
it's better
ما
for
كنت
fixation.
بتسوي شيء هاي مليحه لك
You can tie it better to the mouth.
And this we can. This is also a endotracheal tube, but it is made of rubber and it has also a different gauge, different shariah. What is this?
Nasogastric tube.
شوكولاتة الناس قصدك كتير
Feeding tube. Whatever tube may be is. Don't lose the instruments, please.
No, it's the virus.
Don't lose the pen then. Another.
Nasogastric tube.
This one is a nasogastric tube, and it has a name. I told you.
What's the
name is
point of
Miller.
nasovaginal tube?
Feeding purposes usually.
Feeding purposes into the jejunum directly
Yes.
without it being digested or.
Because special design solutions for enteral nutrition are going to be used on this.
Okay.
Not complex. Basically, food that is partially digested, that doesn't need the gastric and the pancreatic steps of digestion.
I understood. Okay. But this is in case of malabsorption and this stuff,
Not
right?
necessarily. Maybe used also post-operatively, when there is the patient has undergone a surgery on the upper GI tract or on the pancreas, and you want to bypass those areas. You just insert the tube directly into the jejunum through the nose, and also the food itself is going to be delivered directly into the jejunum.
Makes sense.
The idea is this. This is not used anymore. This is a node. You have to remember mainly the idea of nasojejunal tube, that those kind of tubes may be used, again, especially with feeding purposes. It was used 50 years ago maybe. It had a balloon here. And that time it had a name called Miller Abbott. But now because it doesn't have the balloon anymore, it looks mostly like what was also named Einhorn tube. Einhorn tube was just a nasodiodinal, if you want, tube. Yes, another small caliber Pasteur tube. This is I think 22. And I told you, if you remember, this was designed for. But what was the initial?
It was for urine or bladder catheterization.
In female patients.
Female patients, but nowadays we use it for
Either for
drainage and
drainage in the setting of a cystostomy, usually surgical cystostomy, not the percutaneous technique that we have, let's say, worked with during the onset.
lumen nasogastric tube.
You will just get those 5% because you haven't read anything. But if you, again, I will continue with this, especially if you have questions. But if there are some of you that want to go to the lecture, of course, I will not stay against. Because today is a large lecture and it deals with small bowel disorders. Like tumors, maybe Crohn's disease, maybe enteritis, maybe some diseases it may be sources of GI bleeding, polyps, a lot of.
I did this in gastro, it's fine. I'll just revise them.
We have this lecture.
I feel better when I study myself because I can Google, I can see videos, I can do things. I think I grasp more for some reason. Except the LP with you, it's different.
Is that what is best is a combination. One single technique is not, let's say, the best way. Because even though
في
the
شغلات
pyramid of learning says
في شغلات
something,
لا
it is not valid.
تقدر تعرفش اما باقي ما بتعرف وانت متريح يعني عشان اصلا يصعب سجل
That was this. So this one is this one.
Supposedly the esophageal varices.
This is the Blakemore, Sengstagen Blakemore tube. This is the tube used for tamponade of the bleeding gastroesophageal varices in the setting of portal hypertension, mainly in a patient with liver cirrhosis. Not to prevent, to stop the bleeding once the bleeding has already occurred. I mean, you're not going to insert this tube as a preventative measure.
Because of the necrosis.
I mean, no, if you keep it inflated too long, if you keep it inflated too long, it will.
اوكي عارف بس من النازو ولا من
Sengstaken, exactly like you hear. Sengstaken with K, not Tukan. Taken with A, not with C. T-A-K-E-N.
So it was good. Okay.
And this is A, not U. Because also it's a German origin. It's not Sengstaken, it's Sengstaken, it's the German. And Blakemore, and the Blakemore is a Blake, not Black. Blake with C, with K-E. This is for sure English or British or something. So, now, in order to, let's say
Wasn't it Blackmore? Or?
to please your desires, if you want, ask me targetedly on the instruments. I mean, because if I choose to tell you just what I feel that is important, maybe I will neglect what you think that is important. So ask me directly about the instruments.
Show us one and ask someone what is this.
تكون متو
All of us.
So, what are you going to ask me about it that you don't know?
This is Blackmore. You take it orally and it blocks varices.
Nasogastric.
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 Okay. You don't even have to say nasogastric. It is a nasogastric tube.
Yeah.
But again, this is a specialized nasogastric tube.
For esophageal varices in case of
For
liver hypertension.
tamponade of the bleeding esophageal varices, not just for any kind of esophageal varices.
Yes.
Doctor,
It's
how
an
can it
emergency.
pass through the nasal?
You lubricate it thoroughly.
It's huge.
Yes, it is. You insert an anesthetic agent into the mouth of the patient first. You wait 1-2 minutes.
Lidocaine, right?
Lidocaine, spray or solution. Wait. Lubricate it generously, and then educate the patient. Tell him what to expect.
بالالعاب هذا
Okay, and you're not going to insert them inflated, of course, but completely flat with the -1 pressure within. Okay, and then the technique is the same.